Hello, welcome to this presentation on using data science for understanding public health issues. My name is Alekia, and I'm currently a data scientist volunteer at Sharon Kamal Health Group, and I'm currently pursuing a data science degree at WPI. So, health involves all. Um, So, health isn't just a concern for people who are sick or elderly. It starts from birth and it lasts throughout every stage of life. And for each group, there's different healthcare that usually is there. So, for children, they have things like vaccination programs and nutrition to help support growth and preventing childhood diseases like asthma. And for teenagers, there's things like mental health challenges, especially post COVID, and risky behaviors prevention, such as alcohol consumption and vaping. And then for adults and seniors, they have things like chronic disease management, like diabetes and heart disease, and cancer screenings. They also need elderly care to help improve mobility and prevent things like falling. And why this matters for data science. So each group faces different health risks and need different public health interventions. And data science can help us understand these needs and design age appropriate programs. So the key message here is that public health must serve all ages, and data helps us understand and meet the unique needs of each stage of life. So, what is data? So, in a simple definition, data is really just information, and it can be numbers, it can be words, images, or even signals that describe something happening in the world. So, maybe some relatable examples for numbers could be your step count on your smartwatch, and text could be something like a survey answer. And an image could be possibly an x-ray or maybe photos of something like a rash that maybe AI could use to help diagnose. And signals could be like a heart rate from a fitness tracker or something like noise levels in a city. And data also has two different things, such as structured data and unstructured data. So structured data includes organized data in temples and tables, so like Excel sheets and databases. And this could be like blood pressure readings or patient ages. And unstructured data is freeform data. So maybe something like doctor notes or maybe any messages. So data is how we turn personal health stories into patterns, which we can understand and study and act on. And data is all around us, and in public health, it's the foundation for understanding what's really happening and learning how to help. So, what is good data? So, for example, like imagine trying to plan a birthday party with an outdated guest list. That's what working with bad data in public health is like. So, for qualities of good data, it has to be accurate. So, it needs to reflect reality. It has to have things like the patient's correct information, like the correct temperature or anything that we need to know about them. And it should be complete. There shouldn't be any null values or missing responses that you need to have. And it should be timely, so it should be collected and used at the right moment. And it should also be consistent. It should have like the same format across all entries to avoid any confusion. And all information should be relevant to the problem that you're solving. So if the data is wrong, incomplete, or outdated, you could miss an outbreak, or you could risk wasting resources or give the wrong advice. And there's this table here on good data and bad data. So for example, the date format here, it could be blank or it could be written differently, and that doesn't always work. And the age field 17 would be good, but teen or missing doesn't always help because it's very vague. And blood pressure, just saying normal doesn't always help either. So what is health data? Oh yeah, and also good data isn't just about quantity, it's about quality. And public health, you need to make sure you get the right information to make the right decisions. So health data is any information that helps us understand people's physical, mental, and social well-being. So if you were to break it into, and it could come from doctors, devices, surveys, or even phones. And if you were to break it into some categories, it would be clinical data, behavioral data, environmental data, social detriments of health, and digital and personal device data. So for clinical data, this could be something like medical records or lab results, prescriptions, or hospital visits. So for example, a patient's cholesterol test. And behavioral data could be lifestyle choices, exercise, diet, maybe whether they smoke or not, and sleeping habits. So, for example, it could be fitness app step count. And environmental data includes things like air and water quality around you, your neighborhood safety, and maybe any climate data that's available. An example could be the pollution levels, and something like that could be linked to asthma cases. And social detriments of health could be income, that makes a difference, and education, housing, and possibly your access to food. So, for an example, could be maybe some areas have different life expectancies, so maybe there's a correlation with that or like a relationship with that. And digital personal device data could include something like smartwatches, information that you get from that, health apps, and wearable sensors. So, for example, like I said previously, maybe your heart rate that you can get from a smartwatch or a Fitbit. And each type of data gives us a different part of a puzzle. So together you can see the full picture of someone's health and the health of various communities. So it's very important to see all different factors that affect a person's health. And health data is not just what happens in hospitals. It includes habits, your environment, your community, and it helps drive smarter public health decisions. Okay. Public health and data science. So public health, put simply, is about keeping entire communities healthy and not just treating illnesses, but preventing it. And data science is the art of turning raw information into insights using math, coding, and statistics. So about how they work together. When we combine public health and data science, we can ask bigger questions and find better answers. So for example, you could use data to track maybe a flu outbreak in real time. You could target health programs to the people who need them the most. You could predict future disease trends, and you could also improve hospital efficiency and reduce wait times. So public health knows what problems to solve, and data science helps figure out how to solve them faster, smarter, and in a better way. So overall, I would say public health and data science are a really good match, and data science helps identify public health needs. So how do we collect data? So before we analyze anything, you need to collect it. And in public health, there are many creative and powerful ways to do that. So these are some real world examples. One way could be surveys and questionnaires. It could be paper or it could be digital, like a census or mental health surveys. And you can ask questions like, how often do you maybe feel anxious during the week? And another one could be clinical tests and records. This includes lab results, hospital admissions, and vaccinations, and maybe data collected during doctor visits or emergencies. And the next is mobile apps and wearables again, like mentioned previously, fitness trackers, health monitoring apps. It includes your steps, maybe your sleep, heart rate, and sometimes blood oxygen. And social media and digital platforms is another one. So maybe Twitter trends on flu symptoms, Google search data. This was often used during COVID to track early signs of outbreaks. And another way to collect data could be environmental and community sensors. So maybe air quality sensors, noise level sensors, and possibly temperature monitors. And these can, again, like say previously, help prevent things like asthma or heat-related illnesses. And another way to collect data is citizen science and volunteering. Maybe people voluntarily contribute data. For example, reporting COVID symptoms on an app or community surveys. And data collection is definitely a team effort. Sometimes it's professionals collecting data, but often it's an average person sometimes filling out a survey, wearing a fitness band, or using a health app. So health data comes from many places, clinics, sensors, even smartphones, and each one of us gives a valuable piece of information to the bigger picture. So some benefits of health data, of good health data specifically. So good data is like having a clear map. It helps public health teams go from guessing to making smart, life-saving decisions. So this leads to better decision making. So it could help governments, hospitals, and organizations know where to act and how to act. So, for example, maybe they could be allocating more vaccines to certain areas with rising infection rates. And another benefit could be targeted interventions. So, programs can be designed for specific groups, maybe children or low income neighborhoods or maybe seniors. So, for example, launching a nutrition program for schools with high obesity rates, early detection of outbreaks, and could also be another one with real-time data that helps spot patterns early. So, for example, COVID dashboards, Google flu trends, and another way could be efficient. Another benefit is efficient use of resources. So you will prevent waste of supplies, money, and time. So, for example, you could be sending mobile clinics to only the high need areas. And another benefit is improved research and innovation. So you will have accurate data, which enables better science. So, for example, training AI to detect diseases from scans, and equity and fairness. So this you could identify underserved populations or health disparities. So, for example, discovering certain areas that have higher rates of asthma, like said previously. So when we have good health data, we can do more than respond. You can prevent, and you can plan, and you can protect communities. So good data saves lives, not just by treating illnesses, but by helping us stop them before they start. Okay, so can you tell us about analyzing the data and its importance? The next couple slides will have some slides on different tools that we use in data science to analyze it, and it's very important because when you have a lot of data, when you have a lot of information telling you what you can, how you can improve, you're going to want to take it. Not analyzing the data would just be like ignoring some really good constructive criticism. So you can target specific places where you need the most guidance or help by using data science. So rural areas can also benefit from data science because I guess like I said previously, like you need to find specific places where they have certain issues and like allocate certain people to go to those places and get those fixed. Like I know like maybe certain places, like I know a lot of pollution will have certain problems. So maybe you could send people there to fix those specific problems there, given what the analysis says about it. Okay, so what do we do with data? So collecting data is just step one, and what makes it powerful is what you do with it afterwards. So first you clean. So first you clean and organize it, and then you fix any missing or messy values. So for example, removing duplicate entries in hospital visits. And sometimes, like I said before, if you have messy or missing values, then sometimes you end up with inaccurate results. And then you analyze it. You use statistics, coding, and visualizations to find patterns like graphs, which could be helpful. And for example, discovering that asthma cases spike when air quality drops. That's like a correlation and a relation. And then you can find insights. So you turn numbers into knowledge. So maybe a question you can ask is like, why are more teens in this area reporting anxiety? And then you make decisions. So you use the insights you get to improve programs and policies. So for example, adding mental health counselors to schools could be something that you do to help improve mental health in certain areas where students are reporting that they have poor mental health. And you can also share it with the public using dashboards, reports, or health alerts. So an example could be maybe a COVID case map or flu forecasts. And the people who use these insights include governments to help design better health programs, hospitals and clinics to improve patient care, communities to help advocate for change, and researchers will help test new theories or predict future trends. So data isn't just numbers, and when we analyze it, we can make smarter, faster, and better decisions that improve healthcare for everyone. So moving on to tools and languages used. So data science relies on a variety of programming languages and software tools to collect, clean, and analyze and visualize health data efficiently. So two of the most common programming languages are Python and R. So Python is like one of the most popular languages in data science, and it has multiple libraries that will help you do numerical computing, data manipulation, machine learning, visualization, and an example when you could use it is when you are cleaning large hospital data sets or training disease prediction models. And there are many resources online to learn this language. I learned a lot from various YouTube videos that I found online and different free resources and websites that I found as well. And R is specialized for statistics and data visualization. And it's great for public health research. And some other tools are SQL, which is great for managing and querying databases, and you can use it to extract health records or survey results efficiently. And there's also Tableau and Jupyter Notebook, which are user-friendly platforms and coding environments. And you use different tools because there are different problems. So knowing a mix of these can help you tackle very different data challenges that you may come across. So mastering these tools helps you turn raw data into meaningful stories and help you get actionable insights. So some data science techniques in public health. So data science isn't just about having data, it's also about using the right tools and techniques to pull out insights that make a difference. So a technique that could be used is descriptive statistics, which is summarizing the data, like percentages, trends, whatever you have. And like, for example, you can ask, what's the average age of patients with diabetes? And you could use tools like Excel or Python. Another one could be data visualization, so turning data into charts, maps, and dashboards that help you see the data as more of a picture. And maybe you could use it to track COVID cases on an interactive map with tools like Tableau, Power BI, and Python. And then we have predictive modeling, which is using data to forecast future trends. And maybe you could do a prediction of flu season spikes or hospital demand with different techniques like linear regression and machine learning. There's also, speaking of machine learning, there's which is algorithms that help you learn from data to detect patterns. So you could use tools like Python to maybe do things like detecting tumors in medical images or predict disease risk. There's also geospatial analysis, which is mapping data to understand local-based trends. And you can use that to identify neighborhoods with high rates of things like, not to go back to the same example, but asthma as well. And you can, and these techniques help public health professionals move away from raw numbers and go to real solutions, whether that's predicting the next outbreak or improving care access. So data science gives us powerful tools from simple statistics to advanced AI to understand, predict, and solve public health problems. So ethical and practical challenges. So while data science offers powerful tools, it is also important with challenges and ethical responsibilities, especially in public health. So some challenges may include privacy and confidentiality. So protecting sensitive information and risks if data is leaked or misused. And an example could be ensuring patient data is anonymized before sharing it. And another challenge could be bias and fairness, which is data can reflect existing social biases, and this can lead to unfair outcomes or worsen health disparities. So that's something that should be accounted for when analyzing anything. For example, AI tools trained mostly on data from one group may not work well for another group. And another challenge could be data quality issues. So missing, incomplete, or inaccurate data could lead to the wrong conclusions. And having data from a lot of different sources with different formats is how, so that's how data may come in different forms, but you need to make sure that you clean it properly before you use it, or you risk having inaccurate results. And then there's consent and transparency. People should know how their data is collected and used, and there's need for clear communication and informed consent. And timeliness and relevance. So outdated data could also lead to inaccurate results. And real-time data collection is challenging, but it's crucial for times like outbreaks. So ignoring these challenges can have a problem with people's public trust, and it could harm vulnerable populations and reduce the effectiveness of health programs. So ethical and accurate and respectful data use is very important to protect individuals and ensure that public health benefits everyone. So here are some real-world cases. So there is predicting disease outbreaks, which is Google Flu Trends and AI for dengue, and it's a global thing. So what happened is that data from search engines, weather, and social media was used to predict flu and dengue outbreaks. And this helped public health agencies prepare before hospitals became overwhelmed. And the data science technique used was machine learning, predictive modeling, and big data analysis. And it let agencies act earlier than ever before an outbreak hit peak levels. Another case study is asthma hotspots and air pollution, and this was in cities like New York City and Chicago. And what happened was air quality data was mapped with hospital visits for asthma, and it showed strong links between poor air and high asthma rates, especially in low-income areas. So the data science technique used was geospatial analysis and some correlation studies and environmental data. So the impact here was that it led to targeted air pollution controls and health campaigns in high-risk neighborhoods. So data science here isn't just a theory, it's transforming public health, as shown in these previous examples. And these real-world case studies show how we can save time, money, and lives using this. So using data science with public health has proved to be very important. So some career opportunities using data science in health. So data science in public health is a rapid growing field, and with many exciting careers and different paths that could really make a huge difference. So some roles that could be available are public health analyst, where you use data to evaluate health programs and policies and help organizations decide where to focus resources. Another one could be a data scientist or data analyst, where you clean, analyze, and model health data. And you all can also build predictive models and dashboards for decision makers. Epidemiologist is another one, where you study how diseases spread using statistical and computational tools, and you guide outbreak response and prevention. There's also health informatics specialist, where you manage health data systems and electronic health records, and you ensure data quality and accessibility. And there's also policy advisor or researcher, so you translate data insights into actionable health policies. So you advocate for evidence-based public health programs. And the reason these careers matter is that people in these roles turn data into action, helping communities stay healthier and save lives. Some other opportunities that you could have are academic research and teaching. or maybe you could work with a NGO or international health agency. And roles in tech companies are also there, which focus on health, AI, and apps. So whether you love coding, research, or policy, there's definitely a place for you in public health data science. So how to gain practical experience in data science. So theory is important, but real skills come from doing this. And here are a couple ways you can build some practical experience in data science even before a formal job. So you could volunteer with an organization. So you could help maybe nonprofits, schools, or health groups like this collect data and analyze data. So you could assist a local clinic in organizing patient surveys. And another way is personal data projects. You can collect your own data or use public data sets to build a small project or something to practice cleaning, analyzing, and visualizing data. So, for example, maybe you could track your sleep patterns or community air quality where you live. Another way is online resources like YouTube tutorials or Coursera, edX, Khan Academy. I definitely use that a lot, and I find them all to be very helpful. So there's a lot of follow along with project-based courses, and they have courses with all sorts of different techniques and tools, and they teach you a lot of things, like, for example, Python for data science. There are Intro to R courses and also data visualization courses that are offered for free a lot of times. And you can also join data science communities. So you could participate in Kaggle competitions. Kaggle is a place where they have different things going on. They have a lot of public use data sets that I've used in the past. And there are different like forums for that. And you can collaborate with other people and learn from real challenges. And also you could do internships or maybe find research opportunities. So maybe look for internships in health departments, universities, or companies. And using that, you could gain mentorship and experience working on real data sets. So the key is to start small and build steadily. And every project and every volunteer hour adds up to these real skills, and they're super helpful. And you don't have to wait to get started. Practical experience is within your reach, and you can start today. So some future trends. So the future of public health is closely tied to advances in data science and technology, creating exciting possibilities to improve lives worldwide. So there's AI and machine learning, and it helps with personalized treatment plans, and it helps work faster and more accurate disease detection from images and data. There's also wearable devices and real-time monitoring. So smartwatches and sensors track vital signs continuously, and early alerts for health issues before symptoms appear, which could be super helpful in the long run. And personalized genomics and precision medicine. So using genetic data to tailor prevention and treatments helps identify individual risk factors for diseases. There's also big data and integrated health systems. So combining data from hospitals, wearables, social media, and environment, the environment you're in, creates comprehensive health profiles for communities. And lastly, there's mobile health and telehealth. So apps and remote consultations expand access to care, especially useful in rural and underserved areas. So why this matters is because these innovations will make public health faster, smarter, and more personalized for people, helping prevent illnesses and improve the quality of life for everyone. So data science definitely helps tailor it to people's specific needs. So in conclusion for these slides, we explored how data science helps us understand and improve public health from collecting good data, analyzing it with powerful tools, and making smarter decisions. So good data and strong analytics are essential to protect communities, predict outbreaks, and design effective health programs. And whether you're a student, professional, or community member, you can be part of this exciting field by learning, volunteering, or just staying informed. So data science and public health together can build healthier futures for all ages and communities. So that's it for the slides. Yeah, I agree that data science is helping in medical fields a lot these days. So with computer science, like I said before, there's a lot of, and data science to learn online. There's a lot of different resources available for free. YouTube videos are very helpful because you can replay them and go back and maybe read the comment sections. There's also different online courses online, and there's also things like LinkedIn Learning that you could use. I'm not sure if that's free, but if you're in college, maybe your college might offer that. So that's something you could use to get verification and certificates for that. So students can be part of public health by, again, joining maybe volunteering groups or any internships. And how data recording plays an important role. That's one of the most important things. It's important how you record your data because that's what's used to eventually make decisions in the end. Um, and I guess how can small clinics adopt data science? So maybe you could use the data collected from your camps and find out what people need the most, figure out what most of the problems that people have are, and you can maybe tailor your camps towards that, or maybe you can see who usually comes and doesn't come to your camps and maybe try to get some more diversity by trying to figure out ways to market it to other people. So, what's the future of wearable tech like smartwatches in contributing real time data for population health management? So, it definitely improves every year, and there's more and more smartwatches, and there's more and more different types of gadgets that are out there to help with different things like monitoring heart rates and things like that, which could be very, very helpful. And I think they are a good investment. So, what are examples of health data? These are the different kinds of health data. There's behavioral data, like I said before, clinical data, environmental, and digital data. Those are very helpful for, like I said before, they're very helpful for analyzing things and coming to conclusions. Okay. So thank you for coming today, and thank you for listening, and I hope you all learned something today.